Hello, everyone, and welcome to the CareerSTAT 2017 webinar series. I'd like to welcome you to today's event, Integrating Workforce Investments with Business Impact, How to Use Data to Drive Decision Making. My name is Kelly Aiken, and I will be your host for today's webinar. I'm the Director of CareerSTAT and a Vice President at the National Fund for Workforce Solutions. A couple of housekeeping items. First, if you experience any technical difficulties at any time during this WebEx event, please submit your technical issue in the Q&A panel, and someone from technical support will assist you. All attendees will be in a listen-only mode throughout the duration of today's call. And as a reminder, this call is being recorded. The recording session will be available on the National Fund website 24 hours after the call. We will be holding a Q&A session toward the end of today's presentation based on the questions that have been submitted. You may ask a question at any time throughout the event by entering it into the Q&A panel located on the lower right side of your screen. So let's get going. Next slide, please. As many of you know, CareerSTAT is an initiative of the National Fund, and it is a national network of healthcare leaders promoting increased employer investment in frontline healthcare workers, skill development, and career advancement. Next slide, please. I'd like to take a moment to introduce our speakers today. Again, my name is Kelly Aiken, and Shauna Welch is joining us. She's the Regional Director of Talent Acquisition and Human Resources from Mercy Health, West Michigan, and Kelly Wilczak, Regional Senior Sourcing Specialist, also Talent Acquisition Human Resources at Mercy Health, West Michigan. I'd like to thank both of them for taking time out of their busy schedules to be with us today. Before Shauna and Kelly tell you about the Mercy story, I'd like to spend just a few minutes giving everyone some background information about CareerSTAT. Next slide, please. So as I mentioned, CareerSTAT, there we go, perfect. CareerSTAT is a national network of healthcare leaders promoting increased employer investment in frontline healthcare workers' skills and careers. For the last 5 years, healthcare leaders from across the continuum of care have been advocating for employers to create and sustain workforce development programs that foster skill development and career advancement for workers so that they can, over time, move to positions that pay family-sustaining wages. CareerSTAT's leaders are consistently making the case for these investments and the positive impact they can have on healthcare organizations and their ability to deliver high-quality, patient-centered care. For CareerSTAT, frontline healthcare workers are defined as those who provide routine and essential services in all settings, including hospitals, outpatient care, behavioral health, long-term care, and home health care. They're responsible for a range of operations, including providing administrative, direct care, environmental, and technical services to patients, families, and caregivers. Ultimately, we believe that frontline workers form an organization's backbone necessary for delivering high-quality care and ensuring an excellent patient experience. Typically, frontline occupations such as medical assistants, environmental services, licensed practical nurses are the focus of CareerSTAT, and they typically require less than a bachelor's degree, although regional differences do exist. So here in our map, you can see where we have CareerSTAT members scattered across the United States. The network is free to join and open to all who have an interest in healthcare workforce development, including employers across the continuum of care, healthcare workforce partnerships, workforce intermediaries, education and training providers, CBOs, and philanthropic partners. Joining the network is as simple as filling out an online form located on the National Fund website. Next slide, please. As a network, CareerSTAT is dedicated to sharing information and fostering peer learning. Our offerings include strategies to make the case for increased investment in frontline workers, peer learning that takes the form of convenings, site visits, and webinars such as today's, employer recognition for the investments they are making in their frontline workforce, technical assistance, such as our new Employer Academy, which will kick off in November, case studies and best practices, and national leadership opportunities. In particular, I'd like to draw attention to CareerSTAT's Guide to Investing in Frontline Healthcare Workers, published in November of 2016. The guide captures many of the business practices, what we consider best practices, that are being used by healthcare providers making sustained investments in their front line. The guide can be easily downloaded from the National Fund website if you look under CareerSTAT Resources. Next slide, please. Those employers featured in the guide have been recognized as frontline healthcare worker champions or emerging champions through CareerSTAT's annual peer recognition program. To gain this recognition, champion employers are meeting 4 key criteria, while emerging champions are meeting some but not all the criteria, which includes 1, evidence of programs and policies that make learning and advancement accessible to their frontline workers. This could mean defined career pathways, utilization of career coaching and mentoring, training supervisors to better support frontline workers, offering on-site training and education, tuition assistance, and assistance with childcare and transportation. There are a myriad of programs that we know champion employers are offering. The second criteria is reaching program scale, such that at least 50 frontline workers per year or 10% of the total frontline staff are participating in programs. The third criteria is that employers are collecting and using data to assess quality of programming, their ability to analyze impact, inform organizational priorities, and ultimately improve outcomes. And finally, they are demonstrating their ability to sustain programming beyond grant funding, and there is evidence of dedicated resources to support workforce development. To date, we have recognized 24 champions that you can see on the next slide, and 12 emerging champions, which you can see on the following slide. So in total, over the last 4 years, we've recognized 36 champions. We'll be opening our recognition program in January of 2018. So you can see here, Mercy Health is one of our 2017 emerging champions. Next slide, please. From our champion and emerging champion employers, we have learned a great deal about their investments and how they are integrating workforce development programs and other business practices with their organizational priorities and the data and the analytics that drive decision making. This graphic is intended to show that interconnected nature. This has become increasingly important as we have come to understand that sustained programming and impact is only possible if organizational priorities are driving workforce programs, as well as the creation of organizational infrastructure and supportive business practice and policies that support the front line. Ongoing alignment is occurring when organizations have the capacity to collect data and analyze the impact of these programs, such that it's being used to inform organizational priorities. Obviously, it's an iterative process for many organizations. Our champion and emerging champions demonstrate that often organizations have multiple priorities driving the work, whether it's filling critical vacancies, diversifying their workforce, a commitment to hire from within, improving community health through local hire efforts, meeting faith-based missions, and of course, under the banner of the Affordable Care Act and the Triple Aim, fulfilling a commitment to delivering accessible, high-quality care at a lower cost. Next slide, please. So today you're going to hear about Mercy Health West Michigan and how their organizational priorities are driving their evidence-based hiring process, the development of a diverse regional talent pipeline, and targeted workforce programs such as a medical assistance apprenticeship program to fill critical vacancies. We've highlighted Mercy's work in a recent case study in part because they are using data to drive decision-making and to demonstrate the impact of those efforts. They are also employing several best practices that we've outlined in CareerSTAT's Guide to Investing in Frontline Healthcare Workers. In addition to thanking Mercy Health for carving out the time to help us document the great work they are doing, I'd also like to thank Hope Street Group, Metrics Reporting, and the National Career Pathways Technical Assistance Center for helping to make the Mercy case study a reality. A special thanks to James Guest for authoring the case. So now I'd like to turn it over to Shauna Welch and Kelly Wilczak so they can tell you their story at Mercy Health West Michigan. Shauna, take it away.
Thank you, Kelly. It is a pleasure to be with all of you today. Thank you for the opportunity to share some of the work that we're doing in West Michigan. The next slide is our Mercy Health, or our Trinity Health footprint. Mercy Health is a member of Trinity Health, which is the second largest non-for-profit Catholic healthcare system nationally. And this is a coast-to-coast map of the communities that Trinity Health serves. I represent Mercy Health in West Michigan, which includes communities like Grand Rapids and Muskegon. The next slide gives you a close-up of our Mercy Health communities. I have the privilege of leading the talent acquisition team that hires just over 2,000 external hires a year and another 1,000 internally. This is our footprint in West Michigan. In addition, we have affiliations with our Trinity Senior Living Communities, our Trinity Home Health. Also, we have a behavioral health services. So we really provide the full continuum of services and care. The next slide is Trinity Health's framework for our journey to become a people-centered health system. Everything we do and every decision we make helps us support that strategy. Our talent acquisition processes and practices are grounded in the people-centered strategy, and our clear focus of sight is always the people. It's the people we serve in our communities. It's our people or our colleagues, as we refer to them, that work with us. And it's also the people that we bring into the organization and making sure that we're bringing in the right people. The Trinity Health strategy on the next slide. So Trinity Health has set the strategy to become a people-centered healthcare system. Engaged colleagues is one of those True North categories that supports that strategy. Human resources really owns the engaged colleague focus area, and talent acquisition supports that initiative through our workforce development programs to develop a pipeline of high potential talent and our hiring practices that support hiring diverse and qualified talent. The next slide, please. In our time together today, we'll share Mercy Health's effective hiring practices and workforce development programs that include our evidence-based selection process, developing a regional talent pipeline, the launch of our medical assistant apprenticeship program, and how we're advancing our environmental service technicians. The next slide, please. As I mentioned previously, talent acquisition supports our people-centered health system strategy by ensuring we are diversifying our workforce and hiring talent to deliver top quality care. Next slide, please. We know that our colleagues must mirror the communities we serve. Because of Trinity Health's commitment to diversity, inclusion, and equity, we have been asked to be a leading employer for our Mayor's Racial Equity Initiative, which is quite an honor for us in our community considering that we're one of 3 health systems. Next slide. Healthcare, as we all know, is a person-to-person business, and our frontline workers oftentimes have an opportunity to have a much closer relationship with our patients than even sometimes our nurses do. So investing in advancing them is not only the right thing to do, it just makes good business sense. Next slide. So this is our evidence-based selection process. About 7 years ago, Mercy Health went through a complete talent acquisition process redesign. We realized that there was a science to identifying and hiring the best talent. The 2 key decisions were made and implemented that led to some of the results that I'll share with you today. The first being the onboarding process was redesigned and improved to parallel with the talent acquisition process. And second, the talent acquisition tool set was framed around the Hunter-Schmidt research that concluded that the 6 best predictors of job performance are general cognitive ability, integrity tests, structured interviews, consciousness tests, job knowledge tests, and reference checks. Our evidence-based selection process consists of 6 steps, and while it may seem pretty robust, our candidates actually appreciate the thoroughness that we take in making sure that we have the right match. The outcomes I'll share with you on the next few slides are credited to the process redesign and the job analysis work that we've done. Next slide. So this is our selection criteria. For every candidate that gets to the assessment stage, we are assessing their cognitive and character ability to be successful in the role that they're applying for. We confirm in our 360 references if past performances match what we've learned through the assessments about the candidate. We are also starting to have conversations with our community partners about assessing candidates on these elements while they're enrolling in their program. Next slide. These are the key performance metrics that we put in place to really be able to indicate whether we're having success in our process. Some of the data that I'll share is a little wiggly just because of the candidate contracting market that we're living in right now. Candidates tend to have a lot more opportunities than they did a year ago or 3 years ago, but we're still holding pretty strong on really good national benchmarks. So the next slide is our turnover rate. We started at a baseline of 25%. We dipped as low as 19%. And again, with the candidates contracting market, with there being multiple opportunities in the community now, that has inched up just a little bit. But again, we're 5 to 10 points lower than the actual national benchmark. The next slide is a little busy. It is an activity snapshot. This is just a glance of our open and filled positions by calendar year. We have a fill rate of about 84%. Kelly will talk a little bit more about one of the programs we put in place, the Apprenticeship program, to help us close that gap. We have an average time to fill at around 35 days. Many of our nursing and technical positions can take twice as many days to fill. So creating a ready talent pipeline is critical for us. The next slide is one that we are especially proud of and is really attributed to our evidence-based selection process and helping reduce the unconscious bias that exists in every hiring practice out there. It has significantly helped us increase our diverse hiring. We've gone from 18% to 38% in diverse hiring, which has helped us double our diversity in our workforce. This is receiving a lot of attention nationally and locally, and it is attributed to our evidence-based selection process, being able to really understand the competencies and behaviors that we're looking for in our organization. Putting data behind that allows our talent acquisition professionals to advocate more strongly for candidates. So the impact of our evidence-based selection process, on the next slide, you'll see we, again, have reduced our first-year turnover from 25% down to as low as 19% at one time. Our time to fill was reduced. We shaved a few days off from that. We reduced our recommend hire ratio down to 1.4. We've increased our diversity, and we've had a financial impact of a savings of just over $2 million. So in addition to data outcomes, we know that there's other outcomes that have been realized as well. Increasing colleague engagement and output, savings due to the reduced hiring, training and orientation activities, our improved patient and colleague safety, improved patient satisfaction, of course, addressing unconscious and overt bias in our candidate selection, and we're able to arm our talent acquisition professionals with clear evidence to support our talent acquisition selection and recommendations. The next slide, I'm sure many of you, those of us in healthcare, are very familiar with. This is the U.S. healthcare open jobs trend. It gives me a little heartburn when I take a look at this slide for too long. I was actually hired at the lowest point in the end of 2013, the beginning of 2014. And so it seems like from the day I started, we started getting into how do we develop talent pipelines? How do we meet the needs of our organization very quickly. So on the next slide, it was really important to us to make sure that we were developing a regional talent pipeline, building highly effective career pathways, work with national organizations to create standard credentials, and collaborate with our area employers and educators were all things that we knew that we had to work on immediately. The next slide shows one of the ways in we're working with our community partners and our workforce board. This is a visual representation of the comprehensive career portfolio process. It's condensed to a single cover sheet just to share in this presentation, but this helps signal whether or not an individual is qualified and prepared for work with Mercy Help. This process is designed to help individuals who may not have a ton of experience in the mainstream workforce, but who still have very valuable skills and competencies that would be of value to Mercy Help. The career portfolio becomes a significant tool for individuals who don't know how to navigate the hiring process, which includes even those of us deemed highly educated and highly skilled. Sometimes the applicant tracking process and the applicant process online can be very confusing. So our community partners actually use this career portfolio as they're talking with those individuals that they serve in the community to identify and bring forth individuals that Mercy Help might be interested in. The next slide is a visual representation of the comprehensive career pathway planning that we want every new Mercy Help colleague to be thinking about and working towards. One of our goals is that our colleagues at Mercy Help sees themselves as having a career and not just a job, and that includes our entry-level frontline workers. It takes strategic partners with our educational institutes and our workforce boards to ensure the programs and resources support the workforce we need, not only for today, but for 5 years from now. So when we hire an individual at Mercy Health, we may hire them in job 2, but we are beginning those conversations almost immediately on what education, training, credentials do they need to get to job 2 and to ultimately job 3. The way we deliver care is changing and sometimes unknown, so it's critical that we're developing talent that can quickly align with our workforce demands. This is one of the ways that we're helping to do that. Next, Kelly will share how we're developing talent through some of our workforce development programs, including our medical assistant apprenticeship program. Kelly?
Thank you, Shauna. The medical assistant apprenticeship is a registered program with the USDOL, and it was actually the first registered MA apprenticeship in the nation, which partnered with a KHAP accredited educational provider. The apprentices attend class 2 days per week at the local community college, and they work for 3 days per week in a Mercy Health physician practice where they are with an MA preceptor to do their on-the-job training. This really gives them the opportunity to watch an experienced MA. They are learning and they are reinforcing what they are learning in the classroom while they're seeing it in a real-life setting and working hands-on with real patients. The MA apprenticeship has helped us to develop a diverse pipeline of medical assistants with individuals who have experienced barriers to education or employment. Graduates of our first cohort have included Robin, who had spent 30 years working in manufacturing and thinking that she had missed her chance for a career in healthcare. And Teresa, who was a first-generation college student, her brother actually took out a second job to buy her a printer because she wasn't able to print her assignments from home, and he knew how important that would be for her. So those are just a couple of success stories that we've experienced throughout the first cohort of the apprenticeship. And the successes really lay the foundation so that we can develop and expand this apprenticeship model into other high-demand occupations over this coming year. Next slide, please. So as we began to prepare our business case for the MA apprenticeship, a few of the things that we pinpointed were the increased market demand for medical assistants in West Michigan, but then also the Medicare and Medicaid expansion, which projected to bring an increase to our patient population by 25%. At the same time, we were having to ensure that all of our MAs were properly credentialed as a registered medical assistant or certified medical assistant through the AAMA and the AMT. It also aligned with our Trinity Health True North strategy, which Shauna had described earlier, and that was to provide exceptional patient care and colleague engagement. And we found that using an apprenticeship model would actually save our organization money. The average cost of the apprenticeship training, which was the tuition, the benefits, and the wage, was approximately $24,000 per year. Now, the apprenticeship itself is 1 year, and then we ask apprentices to commit to another year of employment with Mercy Health following their graduation, so for a total of 2 years. And our average cost of first-year turnover for an MA was nearly $27,000. So right there, we are projecting a $3,000 per apprentice savings. Next slide, please. In order to make the program sustainable and ensure that we were able to leverage any funding resources that were available, we partnered with our local workforce board so that we could access and then braid together funding opportunities such as WIOA, the America's Promise Grant, the Apprenticeship USA Expansion Grant, and other individual training dollars. We were so pleased when 70% of the first cohort tuition was covered through braided funding. But then when we heard that 100% of tuition for our second cohort was covered through this braided funding, we were just elated. Not having to pay any tuition meant that our actual training cost per apprentice was closer to $17,000. So we were saving our organization nearly $10,000 per apprentice when compared to our investment for the cost of first-year turnover for a medical assistant. Next slide, please. The most challenging part of building an effective workforce development program isn't necessarily the funding or the preceptors or designing the on-the-job training. It's really engaging our entry-level colleagues and whetting their appetite for learning. This is where a training program designed to advance frontline workers within their current role can really make an impact. The Certified Healthcare Environmental Services Technician is a nationally recognized credential through the Association for Healthcare Environment that teaches techniques and standards for how the environmental service role impacts patient care. It combines 24 hours of computer learning modules with 20 hours of paid on-the-job training. Our Environmental Services Director, Kent Miller, was part of the development committee with AHE for this program. At the completion of the CHEST program, our environmental services colleagues also receive a $1 an hour wage increase, which is huge for them. That makes a big impact. So these are just a high-level overview of two of our workforce development programs aimed at advancing our frontline colleagues. I will turn it back over to Shauna now. Thank you.
Hi, if we could advance to the next slide, please. Thank you. So this slide is a little busy, but I wanted to make sure that we highlighted all of the partners that it takes to have sustainable solutions and have an impact in our communities and abroad. You'll see on here that there's educational partners, there's workforce development partners, there are technical partners like metrics reporting, there are national partners like Health Career Pathways, and of course, CareerSTAT. It really takes a community, not just our local community, but our national community, to have sustainable and long-term solutions. Our next slide highlights some of the recognition that we've received for our work. Although we certainly do not set out for recognition when we're setting out to do the right thing and impact lives and impact patient care, but it is nice when you are recognized for the contribution that you're making in the lives of those that you serve. Also, what we've really come to appreciate about national recognition is that it continues to open doors to funding. It continues to highlight work nationally where we can share some of our best practices and learn best practices from many of you. So in closing, on the next slide, Mercy Health really has set out with their workforce development practices and their hiring practices to align with organizational priorities, to recruit from the community through our evidence-based hiring. We're making career advancements accessible, and we form industry partnerships with other employers to make sure that we have sustainable and long-term solutions. And then our final, my final slide, the next one, please. These are resource books. They're guidebooks and workshops. Our work has helped bring some of this material to fruition with the help of many of our partners, metrics reporting. So feel free to ask about these resources. They're made available to those who are interested. And now I will turn it back over to Kelly.
Thanks, Shauna and Kelly. I really want to thank you for taking the time again to tell us a little bit about the Mercy story. And while consolidated, I know that given the time available, I know that this represents many years of hard work. I'd like to just take a chance first to encourage people to enter questions in our Q&A function so that we can get those posed to Shauna and Kelly. I have a couple that I'd like to start with. Knowing that this has been a multi-year process, I'd like to just go back and first ask you, what convinced Mercy's senior leadership to initially make the investment in the evidence-based selection process and the redesigning of the hiring process, as this seems to have opened up the doors for other types of workforce development programs once you actually have seen the type of results that the redesigned hiring process has resulted in? Shauna, do you have some thoughts?
That wasn't referenced in this presentation is the late Tom Carroll, and he was our former Vice President and Chief Human Resources Officer for Mercy Health St. Mary's. And he used to say all the time that we serve patients, and some serve patients directly, some serve patients indirectly. Human Resources serves the people that serve the patients. And so Tom always made a very clear alignment and a clear case for Human Resources always has to keep a laser focus on the patient, that they're at the center of everything that we do. So he started having conversations with senior leadership about supporting an evidence-based selection process and supporting a process that would help us really identify the best talent to come into our organization and putting science behind that. So that was really the primary driver for the work, was to provide outstanding customer service to our patients and their families. And from there, it became a much simpler conversation to have.
And so when you set out the data points that you knew you wanted to track throughout this process, now looking back on it, which are the data points that have the biggest impact on senior leaders?
Well, certainly they were keeping, they look at HCAP scores and reimbursement rates. I mean, those are always drivers in healthcare. But I think today, looking back, the impact that we've had on diversifying our workforce has been a nice surprise to our senior leaders, but it's also one that makes good sense as we serve the communities and the people in our communities. Our senior leadership, they care deeply about employee engagement scores. They understand that our business is a person-to-person business, people-centered healthcare. So not only the HCAP, the employee engagement scores, but how we've been able to diversify our workforce.
Great. That's interesting. And as you are continuing, obviously your work is not done. As you make the case for ongoing investments, do you see any changes in the type of data that you are going to track? And are there specific strategies that you're employing with your senior leaders to ensure that you have that ongoing investment?
Sure. There's a clear understanding that healthcare has to do more with less, that no one expects reimbursement rates to get any easier, and that the only way to do more with less is to have better people, higher competencies, I apologize. I know you hear a little bark in the back. We're working from my home office today. And that means hiring the best people and aggressively developing skills for the current workforce and for the workforce that we need in the future.
And so does that then translate into a different type of strategy that you're using with your senior leaders?
Sure. So really, obviously looking at, workforce development and where the intersections are with our organizational development leaders within our organization, looking at how do we advance those frontline workers into those high-demand, high-wage paying positions. So that's part of our strategy as well.
And when you are working on an internal growth strategy like that, what are the other departments within Mercy that you're most closely aligned with, and who do you see as your champions for doing that work?
Sure. So our organizational development and talent management really is a strategic partner with talent acquisition on this journey. Of course, our senior leadership teams and our executive leadership teams are also partners of ours. Really, when you're looking at bringing in the right talent and aggressively developing them and retaining them, it takes an entire human resource department to really get their arms around that and be committed to that. So talent acquisition being a part of human resources really looks at HR as a whole as being our most strategic partners. And then, of course, a lot of our champions are our frontline supervisors. They're the ones that are managing and supervising and helping to retain and keep our frontline workers highly engaged in the work that they do.
So that's a great segue to a question that's been posed related to frontline supervisors and whether you look at the impact that different supervisors have on turnover rates of their frontline workers. Do you assess or do you use that as part of their performance for supervisors?
We currently are not. However, I will share with you that there are conversations taking place around that. We have a regional director of organizational development and talent management, and she is really focused and starting to take a look at that. We're also looking at training our frontline supervisors and implicit bias training and how to keep highly engaged employees, how to reduce retention or how to reduce turnover and increase retention. So all of those things are focuses of human resources and more specifically within our organizational development and talent management functional area.
Great, thanks. So some folks are asking about the relationship between Mercy, the local community, and the workforce development system in terms of implementing this strategy. Has relationship changed over time as you have as this strategy, particularly developing the talent pipeline, regional talent pipeline? Has it evolved over time? What does it look like, then and now?
So to make sure I understand the question, are you asking has our relationships within the community evolved based on?
Yeah, the question is, what was the relationship with the local community and workforce before implementing your regional talent pipeline strategy, and has it changed?
I think we've always had a relationship with our community partners, but there was so much work that was being done siloed, and there wasn't an employer champion to really get out in front of a lot of these innovative types of programs. So with that, our workforce board, our community colleges, our community organizations like the Urban League and Goodwill, they really, I think, and we did as well, we really found that nice partnership around intentional programming, really looking to make an impact and tracking outcomes. I mean, oftentimes programs are developed, and I was surprised to find out not all of them track outcomes. Great programs, but how are we tracking the success of those programs? And so Mercy Health has always been an organization that is tracking outcomes. Also, what we've done in our community that has really helped advance a lot of our work is our Health Careers Council. That's really formed out of the conversations around being intentional with developing meaningful programs and impacting those in our community and having outcomes. So that Health Career Pathways Council has launched a lot of great work. It positioned our region to go after America's Promise Grant, which one of our community colleges is the fiduciary of that grant, but it's a $6 million grant to help advance health career pathways in our region.
That's great, and that's definitely forming those types of partnerships not only with your fellow employers, but also with your community-based partners and education and training providers is an absolute best practice across the country and something that the National Fund and CareerSTAT absolutely advocate for. So it's really great, and we know that type of partnership brings in resources very frequently across the country. So a couple of other questions. So what advice would you give to those in HR who are trying to secure similar types of investments or really move the needle on on senior leadership making a commitment to the front line? What advice would you give to those in HR?
Have a serious one-to-one conversation with your senior leaders and ask them for strategic guidance. I think that there was a recent, not just one article, but several articles, but there was a recent one that I read around what kind of keeps the CEO up at night, and it's talent. It's human capital and making sure that we have enough of it and the right individuals in the right seats. So I think that the time is right for human resources to have those conversations with their senior leadership teams to really understand what are the strategies of the organization and how can human resources support that, and how can human resources add value to what keeps the CEO up at night. And many articles out there is that it's the talent gap. Mm-hmm. Mm-hmm. So talk about, top priorities, their concerns, and I think that conversation will become a lot easier. Mm-hmm. Mm-hmm.
And obviously you guys have done a good job of being able to demonstrate that there is a return on investment for the types of programming, particularly the apprenticeship programming. Is it always about demonstrating financial return for the C-suite in your case?
Typically, obviously, I mean, with any organization, right? Certainly we want that's a great question, but, at the end of the day, it has to make financial sense. But it's also about the right thing to do, too, right? You have to balance with what's the right thing to do and what makes good financial and business sense. And whenever you're investing in people and whenever you are investing in creating an equitable workforce and advancing entry-level folks to middle-wage jobs, that's always the right thing to do. Mm-hmm. And, by the way, there's a strong business case for it.
So that's actually a great segue. We've got a couple more questions. So people are curious about what does the process look like when folks come into the organization, and who sits down with them and walks through the career pathway map and is tracking their progress? What does that process look like?
There's a few people that are doing that, and we are right. We're kind of on this journey as we speak, right, to create that evidence-based career pathways and that evidence-based coaching within our organization. It's a strong aspiration of ours. We're putting some action behind it. But there are, we've got talent acquisition that's doing some of that initially when they're talking with them. Our community partners are sometimes and oftentimes involved in those conversations as well. And then our organizational development and talent management department is really looking at how do they take that and advance it throughout the entire organization, no matter what level of position that you come into. So strong aspirations, we're putting some action behind it now, but talk to us in a year, and I think we'll be really proud of where we're at.
That's great, and I think it's important for folks who are listening in on this to realize that this is it's a journey for most organizations, and that it really requires kind of constant attention to maintain the infrastructure that's needed to support all these different facets of workforce development. And I want to just point out that Mercy Health is going to be joining CareerSTAT in our inaugural Employer Academy, and I know, Shauna, that one of the areas of focus that you're really looking at is the career coaching model. And I really commend you for trying to think through how you're going to sustain that work and really make it accessible to everybody. Couple of other questions, and then I think we will be out of time. So in terms of who your partners are, there is some question about whether Mercy is a union-based hospital, and if you've worked with any of the labor management partnerships that exist.
Sure. So we have one of our locations is heavy union. Over 80% of our positions are union. We're just starting to have those conversations, but I will share with you that when you are looking at advancing people through health career pathways, they have a vested interest in that as well. So we feel like those are going to be, although there may be some nuances around how we do it and the cost of certain programs and that kind of thing, when you're looking at advancing individuals, I think that'll be the foundation of our conversation, which will make it a lot easier.
Mm-hmm. So you've got shared interests with the unions to help people advance within your organizations. I think that's
Absolutely.
Where most organizations are starting from.
Mm-hmm.
In terms of the work that you are doing with the CHEST certification, can you talk a little bit more, as well as with the apprenticeship program, if English language acquisition has been a barrier for frontline workers to pursue those types of training opportunities? And if so, have those barriers been addressed in some sort of way?
You know, surprisingly, Kelly, they have not yet. Although I will share with you that we have had some conversations and some very intentional meetings with our local literacy center around how do we develop opportunities for refugees in our area. So we know that may come into play at that time. But we're partnering with the right organizations to make sure that we're overcoming some of those barriers when they present themselves.
Great. So people are really appreciative of the sharing of the guidebooks and are looking forward to sharing those. Can you give a plug for where they can actually find those guidebooks?
Oh, geez. Well, I know that metrics reporting, you can find the guidebooks through there. And we can probably send out some information, maybe, Kelly, on links to get to those guidebooks. I think we may also be able to get to them through Hope Street Group, which is, a national partner of ours as well. So,
and I do think that they might be available through Amazon as well. So I think
correct.
Folks can Google it, but they are out there and available and a great resource.
Thank you.
So I'd like to. Do you have any concluding comments, Shauna or Kelly?
Well, just for myself, I want to thank you for the opportunity to share our work. I'm excited about the launch of these learning webinars and look forward to learning best practices from others. And looking forward to, as you had mentioned, the Employer Academy that launches in November. So looking forward to taking the foundational work that we've done already and really advancing that work.
Great. Thank you. And if we could advance to the next slide. we were already there. There's Shauna's contact information. Again, this will be available. Folks are asking if this is being recorded. It is, and it will be made available on the National Fund website. So please look for that within the next 24 to 36 hours. It will be posted there. And so I'd like to close by bringing your attention to the next set of webinars that we are going to be having. If you could move to the next slide, please. So as Shauna mentioned, the goal of these webinars is to really feature champion and emerging champion employers and the work that they are doing. So we will be hosting one on October 11th, Pathways and Partnerships, Strategies to Advancing Healthcare Workers, Incumbent Workers. And this will feature the work of Beth Israel Deaconess Medical Center and Hebrew Senior Life in Boston. In November, we are going to be focusing on investing in your backyard, strategies to hire, retain, and advance local community members. And this will particularly highlight the anchor institution strategy that Ochsner Health System and Fairview Health Services are using. And I'll make a plug. If anybody's interested in learning more about the anchor institution strategy, they can check out the Democracy Collaborative Hospital Toolkit, which is a great resource. And then finally in December, we are focusing on making learning and advancement accessible, work-based learning programs and HR practices that really support frontline workers. And we will be highlighting the work of university hospitals. So we hope that you will join us. We hope that you will take a few minutes to join CareerSTAT, either as a member or to be on our newsletter distribution list so that we can keep you informed. And we really look forward to talking with folks. Please let us know what is of interest to you as you are working to increase employer investment in frontline healthcare workers. As we are building out our network, we're really interested in engaging more with organizations of all types and learning how we can really meet the needs of organizations who are doing this hard work day in, day out. If you could move to the next slide. I'd just like to put out my contact information and close with another plug for joining the CareerSTAT network. And we're ending just a few minutes early. So please enjoy the rest of your day. And again, want to thank Shauna and Kelly for taking the time to share the Mercy Health story. Thanks so much, and have a great day.